Let's talk about low-dose naltrexone. Low-dose naltrexone is one of those medications that most people have never heard of, but in certain circles, chronic pain, autoimmune diseases, gut issues, it keeps coming up. Works very differently than most of the medications we use. So today I want to break down what it is, how it actually works, where it helps, and where it doesn't. Low-dose naltrexone is just a smaller dose of naltrexone. However, at full doses, it's used for things like alcohol or opioid dependence, and it blocks the opioid receptors completely all day. At low doses, it behaves very differently. Instead of blocking these receptors continuously, it blocks them very briefly. This is the part where most people don't understand, but low-dose naltrexone works through a rebound effect. First, it temporarily blocks the opioid receptors, and your body senses that drop in signaling and compensates by further increasing endorphin production. That's your body's own pain medicine, increasing receptor sensitivity, maybe even receptor density. And so it's now making more receptors, more sensitive receptors. And so when the medication wears off, you get a rebound effect, more natural endorphins, better signaling, a more responsive system. This can impact pain, mood, and your immune system instead of suppressing the body to help regulate it. One of the main reasons people use low-dose naltrexone is for inflammation, but it's not acting like a steroid or just a blunt anti-inflammatory tool. It appears to calm overactive immune cells, reduce inflammatory signaling, help regulate immune response rather than shut it down. Think of it as like turning the volume knob down on an overactive system, not turning it completely off. One of the cool things is gut health. Your gut is one of the largest immune organs in your body. So influencing the immune system, what it does is it helps reduce inflammation in the gut. When the immune system is less reactive, the gut lining tends to be less irritated. This may help in autoimmune gut conditions, and there's some evidence that it may help in conditions like Crohn's disease, ulcerative colitis, and not as a cure, but helpful as part of a bigger plan. It can improve gut-brain signaling, and so it can help reduce pain, bloating, gut sensitivity. Sometimes people just report, my gut feels calmer. And so it may help support that gut barrier function as well and help with intestinal permeability. Again, not a magic fix, but supportive. It may help influence gut motility. Some people notice improved regularity or less cramping. But what it doesn't do, it doesn't fix your microbiome directly. It doesn't replace nutrition, sleep, or stress management. It does tend to help people with chronic inflammation, autoimmune conditions, irritable bowel syndrome with pain and sensitivity, and then overlap symptoms of these like fatigue and brain fog. It's much less helpful in people who are dealing with a poor diet, looking for a quick fix, or expecting it to replace lifestyle changes. Overall, low-dose naltrexone is usually well tolerated. It can have some side effects, and if you have any, it's typically some sleep disturbances early on and sometimes vivid dreams. We will get you to take it at night because it can make you a little drowsy, mild headaches, and it also doesn't work overnight. It's something that builds over weeks. We're starting low and slowly increasing. And so how do you even know that it's working? People will notice better sleep, subtle movement improvements, feeling a little bit more stable overall, but a lot of people won't feel anything directly. So what are we looking for? We're kind of looking for trends: less pain, less gut sensitivity, fewer flare-ups, more consistent energy, less pain medicine needed in like fibromyalgia. Not a feeling, but a pattern over time. And this usually shows up gradually over several weeks. Whenever we are trying to dose this, we're not trying to get to a specific number on everybody. The goal is to find a point where the patient is improving. So what we'll do is we'll start low and increase gradually and wait for a response. And we stop increasing when one of three things happen. Symptoms improved. If they improve, we just stay there. If side effects show up, if sleep worsens or they don't feel right, then we're going to back down to a previous dose. Or if there's just no additional benefit, if we increase the dose and you don't feel better, you don't feel worse, then we might as well back down and go to the lowest effective dose. If someone gives it an appropriate trial and nothing changes, it just may not be the right tool. And so we're not just chasing the dose, we're just kind of more paying attention to the response it gives us. And so typically we don't use this as a standalone treatment. It's layered on top of nutrition, sleep, stress management, further gut health evaluation or gut health protocols. It does help improve the environment for all of these to work better, but it doesn't replace the fundamentals. The honest takeaway is low-dose naltrexone is an immune modulator, a neuroinflammation regulator, and a useful tool for the right patient. Again, it's not a gut reset. We're not going to claim to cure anything from it, and we're not going to use it to get around lifestyle changes. But when it's used correctly, it can be very effective. If you found this helpful, hit like and subscribe, where we try and break this down without the fluff. If you've ever used low-dose naltrexone, drop a comment and let us know, what dose you had to do, how long it took you to get symptom resolution, because really I just want to get more experience with it overall. We are using it and getting good results, but it's just something that's not used tons, and so I'm always interested to hear others' personal experiences with it. So if you have any experience, let us know, whether good, bad, indifferent.